everyone's well today. I really appreciate everyone coming out this afternoon. This is the second public forum. We had one at 10:30 this morning, and so this will be our second one. I'll just go over kind of the agenda if I could. What we'll do is just kind of review the context of the implementation plan. We'll review where other county boards are within the state. We'll review the recommendations of the Conflict-Free Case Management Task Force. We'll review the feedback we received from the focus groups, and then at that point we'll open up the meeting for public comment, any comments you may have. So that's kind of really the agenda for this evening. I do want to recognize two people in the audience tonight. We have two board members that are here. We have Becky Stallman. She is the chair of our personnel committee as well. And we have Richard Hoffman, immediate past president, and he is also the ex officio member of the board to the TWI board. So glad they're here tonight, and certainly appreciate everyone's being here this evening. So what we'll do, again, we'll review kind of the context of why we're here and what has gone into effect, our new regulations that went into effect on March 17th, 2014 from the Centers of Medicare and Medicaid Services. Those new regulations govern three things. First is integrative environments. The second is person-centered plan. And the third that is really driving this change is the conflict-free case management conflict-free case management issue. And you ask, what is that? That basically says an entity cannot be the provider of waiver services and also be the author of the person-centered plan and provide case management, which we do through our service and support administrators. So that's the regulation that came out. The Department of Developmental Disabilities, based on the advocacy of many of you in this room, across the state, said, look, CMS, this time frame is too short for Ohio to come in compliance with this conflict-free regulation. Would you revisit this for Ohio, because we're in many respects unique, but certainly other states have this issue as well, where entities are a waiver provider and they are also the case managers. So what we found out back in July of last year, the Centers for Medicaid and Medicare Services accepted the department's proposal, and Ohio has been given till 2024 to come into full compliance with this caveat. You have to be at 30% by 2020. March 17th, 2020, you have to have reduced this issue in Ohio where county boards are providing services down to 30%. And then that reached every single county board in regards to this issue. Yes, sir?
That 30% of the county boards or 30% of each county board?
Yeah. It is 30% in the state. That's a very good question. So down to 30% within the state. However, each county is responsible for submitting a benchmark plan. And the ones that have been approved, which ours has been, it was originally, it was not, was each county board has to be within 30%. And that's a state requirement. So when they looked at our plan, they said, look, we don't believe, given this plan, you're going to be down to 30%. We're requesting a revision on that plan. So does that answer your question? So 30% for the state is the federal mandate. Ohio has reached out to our county boards through administrative rules and requiring all county boards to provide a plan to get down to 30% within each county.
Well, the other question is 30% completed or 30% left? It could be either the way you say it.
Yeah, it's 30% left. Yeah, so we know in this county that the number we have to reduce is 100 each year or 500 all at once. So to reach that measure by March 17th, 2020. So, so county boards can only be a home and community-based service waiver provider until 2024 unless there are no qualified and willing providers in the geographic area. So there is a caveat here. There has to be, no willing and qualified providers in the area. So those are kind of the context which we are under at this time. So where is Ohio? So this is all the county boards in the state, and the red are the county boards that have already privatized. The green, they're in the process of privatizing. The blue, in discussion, and then in the gray, or the silver and the white, is those that are still totally county board operated at this time, or primarily county board operated at this time. So 31 counties have already privatized, and you can see the rest in regards to differing stages of compliance throughout the state. Where are we, and what have we done? Well, we have, even despite this regulation, have, through 2 strategic plans, have been decreasing our provider role. What we have done is moved in our first strategic plan back in 2010, said, hey, we're going to move from being a predominant provider of services to funding more services. And then in our second strategic plan that was approved in 2013, we said, look, we want to increase the number of people served by other providers. So it's been 2 plans that we have really been moving this way. And if you look at our numbers, they will indicate that we are moving in that direction. Back in 2010, we provided facility-based services to 553 people. Today, we provide to 276. And if you go to the next, there's 45 people, and I think it's even increased to 49, Mike, is that correct?
Correct.
That are attending board services a couple days a week, and then private providers a couple days a week. You see supported employment, we served 187 back in 2010. Right now we're at 127. And where are those people going to? We have been transitioning since 12 or 13 enclaves where TWI is operating them directly. And so we're down to 127, and we're slated to move 2 more enclaves over to TWI effective July 1. In regards to competitive employment, we have stayed about the same number. And then you see in transportation, we have significantly decreased the number of people we serve through our yellow bus transportation. And we have, back in 2010, we had 450 people served. We're right now at 117. So these things have been occurring through enhanced choice back in 11 and 12. And then in 13, we did close admissions to our facility-based services. So you had to choose a private provider at that point, and has been going forward. And certainly the consolidations did impact the number of people served when we consolidated Cohen Juliet and then also Hero Whistledale. So all impacted the number of people we serve, and in many respects it was an intentional move to decrease the number of people we supported directly. So these numbers are as of January 1. Non-medical transportation, we were at 25% board provided, 75% privately provided, and then we're about a 50-50 split as of January, board provided versus by the rest of the provider community. And as I noted in regards to the gentleman's question, which requires us to reduce 500 people by March 17th, 2020, to meet that 30% benchmark. Now, to the Conflict-Free Case Management Task Force. This was a group of 34 people assembled. There's been certainly a number of feedback through the focus groups that has criticized certainly the forming of this task force and who sat on it. And we acknowledged those concerns and complaints. But it was made up of, again, individuals. It was made up of parents. It was made up of union members. It was made up of administrative staff. It was made up of private providers. So, and all had a lot to say. But based on 2 days of the kind of work that was facilitated by an outside facilitator, came up with 3 recommendations. The first is the board will no longer be a certified waiver provider effective January 1, 2018 for adult day services, adult transportation, and supportive employment. The second recommendation is individuals and families will have from now until December 31st, 2017, a year and a half, to choose another provider, or they can choose to stay where they are and be served by TWI as the new provider of the current Start DD adult programs. The final recommendation is, in regards to this issue, is effective January 1, 2018, TWI will operate as any other private provider without financial support from the board. The only contractual relationship would be a lease agreement to occupy Higgins and West Stark. TWI will interview board employees and hire at their discretion. So those were the 3 that really had import, and I'm sure that's what brought many of you here today, and it brought many of you to the focus groups that we had May 18th through the 20th. Other recommendations of the task force, and this was, again, driven by certainly family and even the private providers in the room, in regards to develop a gold standard provider criteria to assist individuals and families to make informed choices. So this gold standard provider would be worked on jointly with the provider community, and it would have indices of meet this level of staff training, meet this level of quality assurance, and retention levels, and in regards to identifying MUIs in regards to the rate of pay. So there was a number of things talked about there to really say, okay, individuals and families, we know it's a very cumbersome process in choosing a provider. We want to jointly with the provider community have a gold standard to help the selection process. And that is in process of being developed, and we'll have that launched probably by the end of the year. Does that sound right, Emily? Yeah, by January 1, 17, we will have that gold standard. We'll have people on board, and hopefully that does assist individuals and families going forward make decisions about who they want as a provider. Next is educating individuals, families, and providers in the Stark County community why and how these changes will be implemented. Certainly the how and the when, we're talking about now, but certainly there's a lot of devil in the details that need to come out thereafter. So, once we get the decision next Tuesday, certainly we will then have a very specific implementation plan, and we'll share it with individuals, families, providers, and all the citizens in Stark County for that matter. The focus group feedback. So we sent to you all the questions that came from the focus group sessions. So we had 382 people there, generated, a group of, 13 questions, I believe it was, and we sent those out. Why 2018? how do you pick a provider? Why can't an SSA recommend a provider? There was a host of questions here. So we answered those and then we sent those out. But there is certainly more to the story in regards to what happened in those focus groups, and certainly want to share those now in regards to the specific comments. Now, specific comments were grouped and categorized into points of pride. And those points of pride are individuals are safe, happy, and feel successful, making a difference in individuals' lives, carrying exceptional service and passion for service, a number of individuals out working in the community, our staff's experience and longevity, our schools and the private primary service provider initiative. It's a great place to work with good staff support and togetherness, great annual satisfaction surveys, board being proactive with the mandates. Individuals who leave are very successful. Great pride is shown across all groups in the services presently supplied by the board, and the quality of those services as validated by the recent 3-year department accreditation survey. So those were all points of pride that were voiced by many of you that participated. And certainly we know those things, and we value our staff and who have been able to deliver a very, very high level of service. In regards to points of concern about the conflict-free case management task force, what were those points of concern? There was great concern expressed over the recommendations made and significant anger, not by all participants, but by a significant majority. The rationale for the dates selected and implications for individuals, families, and staff were most often expressed. Another point of concern was provider quality and care and safety, lack of provider rating system and time available to monitor providers, having adequate time to meet providers, visit sites, and make good decisions, amount of communication and lack of specific details regarding transportation and future services, the viability of future levies. This transition's money-based and not on the care of the individuals, parents' anxiety and not knowing what to do, service availability for individuals without waivers, services availability for individuals that are most difficult to serve, belief that the task force and focus groups are for show, fear the school will close, individuals not knowing where they're going to go. So when the impact group, who was the facilitator, met with 21 different focus groups, individuals, family members, staff, providers. These are the points of concern, points of pride, and here are the suggestions. Assist staff with vocational options to stay in the PRS retirement system. Assist staff with job training and writing resumes and interviewing. More retention or buyouts. Provide and implement a detailed specific timeline plan. Some date other than January 2018. Communicate more frequently and with more details. Provide greater clarity and specific talking points. Have the superintendent speak with individuals more. Teach individuals to deal with change. More focus on the positives for individuals as this rolls out. Allow more time for parents and families to understand the transition and make informed decisions. Assure parents, families have information on how to select a provider. Set SSAs as a private agency. More efforts collaborating with public schools in helping them understand those we jointly serve. Offer training for providers. Have multiple vendor fairs annually. Some date other than 2018. Assure providers have input. Increase where possible board involvement with providers. So those were the suggestions put forth by the 382 people that participated. And certainly our board received this report, saw these exact things, and certainly this decision is heavy on their hearts, I know that. And certainly it is weighing on all of you. I know that certainly has brought everyone out today, both in the morning session and this evening session. So, we would like to hear more of your feedback at this time.